The National Council recently completed a 5-part webinar series looking at AI and behavioral health. So we covered topics from like your 101 type of content around AI, all the way to our last webinar was around some of the risk and legal liability questions that come up when using this technology. And so when we had asked webinar attendees, during registration, we asked them a few of these questions. And so pretty interesting results that I'd love to share. The first question we asked, are you familiar with the basic concepts of AI as they apply to behavioral health? You had 15% say not familiar at all. I think that's probably a good number. You had 40% that said slightly familiar, and you had 34% that said moderately familiar. So that was the bulk, either not familiar at all, or really was either slightly or moderately familiar. And so what that tells me is that folks are listening, they're reading up about this, they're trying to keep up with it. The next question was, to what extent do you agree with the statement, AI technologies will enhance the quality of care provided in behavioral health settings? And here we saw also a really interesting trend. Very, very few. So in total, less than 3% said strongly disagree or disagree. So that would mean that I do not think at all that AI technologies will enhance the quality of behavioral health care. You had 47% that said neutral. And that's, so almost half of our webinar attendees are kind of not sure. You had 39% that agreed and then 11% that strongly agreed. So that's about your other 50% or so that's saying this is going to have a positive impact. So the fact that half are neutral and half are towards positive, I see that as a great trend. The last question we asked, has your organization currently adopted or integrated any AI technologies into your organization's daily activities? I'll note here that we did not define what is AI technology. We asked just yes, no, not sure. So 14% of respondents said, yes, we are currently using an AI technology or in the process of adopting it. 27% said not sure, which was interesting. And then 59% no. So a lot of green space for use here among behavioral health providers. And those who said yes, I just want to double click there for a second. The 14% that said yes, not everyone responded with which technology they were using, but for those who did, I'd say about half listed a non-compliant or a non-use case technology in behavioral health. And what I mean by that is I'm using ChatGPT for my AI technology. And again, we did not ask in what way are you using it, but we, again, anecdotally know and expect that there may be some providers that are using these, again, non-HIPAA compliant, these non-specified for use cases for things like clinical documentation.